good morning, good afternoon now. I'm very quick, okay? You know my name is Mary Jane Mundy, right? I am certified hemodialysis technician, commonly referred as CCHT, state of Texas. I am placed here to Reliance in Houston, Texas, 2013, Women's Health and Fitness Expo. So how's everything going today? Good? Today I'm volunteering with Jen Smith. Williams, co-founder for Kidney Contenders. We'll discuss about the 3 causes for kidney disease, and which diabetic hypertension and congestion heart failure.
Kidney Contenders conducted a case study on a female dialysis patient who had diabetes uncontrolled type 2. She was our first case study, so we referred to her as Jane Smith number 1. At the time, she was 53 years old. She had been on dialysis for a total of 6 months, and she had been a dialysis patient since July 5th of 2011. And her racial ethnicity, Hispanic American female. So her primary diagnosis was uncontrolled diabetes type 2, hypertension, and then nerve damage throughout her body due to the diabetes. The one thing that she had a problem understanding was how the diabetes restricted the blood flow throughout her body. Her primary care physician had told her that the hemoglobin in her blood, which carries the oxygen, it was reducing, and as a result there was less and less oxygen getting to the vital organs like her kidneys. When she spoke to her nephrologist about what she should be eating and how her lifestyle should be, of course a renal dietitian was present, but the one thing that she took from her conversation with her nephrologist was that her blood cells were producing less and less hemoglobin. And when she put 2 and 2 together that, oh, well, less and less oxygen to my organs are just going to die, that's when she took control and started focusing more on how she could get better while still being a dialysis patient. So the rule of thumb is, when you talk to your primary care physician, first off, you should definitely seek out a primary care physician. That's number 1. Number 2, when you talk to your primary care physician and he or she provides you with, this is your general history and physical, this is your general report on what symptoms you may have in the future, you want that person to break it down, break that medical terminology down so that you are on the same, so that way that person is on the same level as you. It doesn't matter if it seems as if you're dealing with a 3rd grade teacher, because that person's broken it down to that education level. You want to be able to take the information that primary care physician provides you with and utilize it. Keyword is utilizing the information. So if the only thing that our case study number 1 understood was that less and less oxygen was reaching her vital organs, she understood that means no oxygen to vital organs, imminent death. Painful at that. Case study number 2 that Kidney Contenders conducted was based on hypertension. So we refer to our case study as Jane Smith number 2. At the time, Jane Smith number 2 was 77 years of age, racial ethnicity, white American female. She had been a dialysis patient since September 9, 2009. Her total time on dialysis when we interviewed her was 3 years and 1 month. Her primary diagnosis was hypertension, and her secondary diagnosis, actually, they gave her was COPD, chronic obstructive pulmonary disease. So this particular Jane Smith understood what hypertension had done to her arteries, And she also understood that her heart was pumping into overdrive, which caused problems to how the heart was pumping the blood to begin with throughout her body, thus affecting the rate of blood flow entering and exiting her kidneys. This particular Jane Smith, like I said, she was very well aware of hypertension. She spoke in depthly with her nephrologist. She's actually from the Dallas, Texas area, and she was polite enough to meet with us one afternoon and kind of go over what she understood hypertension to be. The biggest issue she had with the general public, she felt that we being the general public, not on dialysis, we have access to so many different outlets to learn more about what our diagnoses are. When we go to the general practitioner and the general practitioner tells us this is what's wrong with us, we have so many opportunities to go on Google or Yahoo or just, web search engines and really look up what these diagnoses mean and to kind of control the outcome. Now, given her particular age, it wasn't that she wasn't savvy enough. It was that she went to her general practitioner. She was told she had A, B, and Z, and C. And she just really felt that it was kind of too late to do anything about it except get on medication, and eventually her kidneys failed and she ended up on dialysis. Luckily she didn't pass away. She was able to go on dialysis. She's not interested in a kidney transplant. Her family offered to go for testing to see if they were a match, and she refused. That, of course, is her choice, but the biggest thing that she asked us to emphasize in an article, because at the time we were writing an article about hypertensive kidneys, and she wanted us to emphasize the fact that hypertension is a silent killer. And when it occurs, it is extremely, extremely deadly. The biggest issue that she had talking to people that were not dialysis patients was emphasizing that the lifestyle choices were not just causes for hypertension to occur. And that is probably the only thing that she kept stressing the most. The thing to understand is that we're not having these long discussions with nephrologists or general practitioners. We're not sitting down with these doctors. We're sitting down with individuals who are suffering from these diseases, and we're listening to how they explain what they know and what they've learned and what they want people to know. Kidney Contenders conducted our third case study on a dialysis patient who suffered from congestive heart failure, commonly referred to as CHF. She was a willing participant in our interview. However, she was very conscientious of her medical history, and she did not want her medical history out there for everybody to know about. Of course, we refer to her as Jane Smith, number 3, case study number 3. CHF, in her situation, was not something she did not expect to be diagnosed with. Black American female, not from Texas though, age 59, dialysis patient for the past 10 years. One of the things that she understood very clearly was that there was a decrease in her cardiac output from her heart over time. So there was a lot of stress put on her heart in order to pump that blood. And when, of course, there's a deterioration in the pumping, the blood flow rate, of course, decreases. There's arterial malfunction and a whole bunch of issues that can eventually affect kidney function. The thing about congestive heart failure to understand more than anything else is that it is heart failure, and that is meaning that the heart is not going to be able to pump enough blood to meet your body's needs. Now, even though this case study number 3 refused to share her medical history, that was her choice, she did understand what CHF meant for her. Now, heart failure apparently runs in her family, and this was something she found out after her parents passed away. Ironically, both of her parents, though, had passed away from cardiac arrest. Now, not getting too into the medical reasons why it would be wonderful to have a cardiologist here, but we do not have one today. The primary thing you need to understand is that if you have this diagnosis, it means your heart is not able to pump the blood the way it should. It can affect one side of the heart, or it can affect both sides of the heart. It is the weakening of the heart's pumping ability to keep that blood flow going the way it's supposed to. It is so important to understand that. Now, physical exams, heart tests, all of that can be conducted by a cardiologist. Of course, it can also be conducted by a primary care physician. These are just some of the reasons why it's so important to make sure you understand, you get your medical checked out when you're young, follow through, and if you have any questions, make sure you ask. As well.